Dr. Kapil Salgia. He's the consultant chest physician at Bombay Hospital and Medical Research Center. He joins in on the show right now to really help us cope with this changing weather and, of course, the kind of smog that one is currently witnessing in Bombay. Kapil, thank you so much for taking the time out and joining in today. What's happening with Bombay? I mean, I was so used to talking about pollution and talking about Delhi, but not quite. Bombay is more polluted than Delhi.
Yeah, I guess the rapid construction activity, the metro work, the roads being dug up, everything at the same time with the constant swings in temperatures is contributing to significant air pollution. Even in our clinics, the number of people suffering from respiratory tract illnesses or people with an underlying lung disorder requiring hospitalizations, intensive care in the elderly group has significantly gone up. Viral pneumonias are also on the rise right now in the past 2-3 months.
Now, I don't see anything changing. Construction activity is not going to come down in Bombay. Weather patterns will remain erratic. That's out beyond our control. And metro is not going to start functioning from tomorrow morning. Yeah. So you have to perhaps live in this kind of a environment now. What is the immediate recourse one should do? Start wearing masks, start eating vitamins, start eating supplements. How can one prevent your poor lungs from this kind of pollution?
For people who have an underlying respiratory disorders like COPD, asthma, they should comply with their inhaled medication quite regularly. They should not stop their inhalers and optimize their treatment. At the same time, the other group of population which is at risk are people with underlying diabetes or ischemic heart disease should take proper care whenever you are moving out. If you can avoid a rickshaw or a two-wheeler drive or use a protective mask while driving, that could help you. If possible, move around in an air-conditioned vehicle so that at least the road pollution can be triggered off. Early morning jogs or walks, especially for people with an underlying asthma, we normally don't advise in this season because of the smog which is there, and they do get exacerbation of their symptoms. Sometimes this allergic inflammation of the airways may get infected, and that's the time you may require for few course of antibiotics. But a lot of our patients are having intractable cough requiring the use of inhalers, at least in the stopgap arrangement for 2 to 3 weeks for this symptoms to settle.
Okay. But to the other question that Nikunj was asking, are there any supplements that you can take, boost your immunity, have more vitamin C? I don't know.
Basically, vitamin C and vitamin A and vitamin C could be helpful for your taking care of your respiratory tract. So basically, intake of natural fruits and vegetables which are rich in vitamin C will definitely help you. In the elderly group, definitely you can have a multivitamin supplements. But for young people, just having an adequate amount of fruits, green salads and all could give you the nutritional requirements that you require.
I have a personal question. I have an 8-year-old boy.
Yes.
He goes to play in the ground.
Right.
He's going to be jumping around in the school.
Right.
He goes in a school bus. There's no air conditioning there. Right. He plays in the school during the play time. Right. I possibly cannot imagine that school kids would be wearing a mask and playing.
No, I'm not talking about school kids who would be requiring, but at least suppose if you're walking on the streets and you're having these symptoms, if you're walking on a stretch of road, like even outside your office, it's like completely dug up. So that is something that is avoidable.
So wearing mask should be a part of a lifestyle now.
At least if the air pollution is so bad and someone is having a respiratory tract illness or someone with an underlying asthma, COPD definitely would be recommended.
And one should not confuse the coughing symptoms with coronavirus. I'm asking a very basic question.
No, coronavirus, I don't think so. We have that number of cases in the country. Few cases that have been seen are people who have come from China.
Okay.
But there are all other viruses which are always there in the environment. We had the H1N1 virus 2 years back. We had the MERS and the SARS couple of years back. So there's some other virus is going to come, and some viral illnesses can be fatal. You have patients who suddenly go on to the ICU, ventilator. So those groups can happen, especially in the high-risk groups who have underlying comorbid conditions.
But is it typically this changing weather pattern which is also accentuating this sort of viral incest?
Yes. So normally in the winter season, we do get a surge in the number of viral infections because of the temperatures dipping down, the smog which is there. So that is the flu season where we did. So adequate vaccination. So all people who have an underlying lung disorder or people who are in the elderly subgroup should be adequately vaccinated with the flu vaccine at least once in a year. You have pneumonia vaccines which are available, pneumococcal vaccines which should be taken by the high-risk group quite regularly. Normally, a lot of people who travel to the US, sometimes they find it mandatory. They've been advised by their kids to take the flu shot and then come to the United States. So vaccination is something that we can improve, so that will at least decrease the flu-related mortality and morbidity.
So that's exactly what I was going to ask you, that in terms of long-lasting effects on health, longevity, are there tangible implications of this kind of air quality? Because in the last few years, we saw it first in the capital. Now we're seeing it here in Mumbai.
Yes, so what happens in this season, even in Delhi, what we saw, the number of people who required nebulization, hospitalization went on increasing. The most vulnerable groups are the kids less than 5 to 7 years of age and the elderly population. So normally at times we had to tell our patients with an underlying lung disorder, please don't go to Delhi in the winter season because it has been so bad. So adequate treatment with vaccinations is something that is there, and regular exercising, taking care of your health, avoiding cigarette smoking, too much of alcohol intake can also help you in boosting your immunity, sleeping well. So those are the few things with regular exercise which will give you some immunity and protection. But if you are having an intractable cough, see a doctor. If antibiotics are not working, then it may not be an infection. It might be an allergic airway disorder which needs to be handled with an inhaler at times.
Okay.
Just on the question that Nikuj was asking you, that he cannot see his 8-year-old going around wearing a mask. What are the precautionary steps that children can take?
Right. So I would tell Nikuj, you don't really require to send your kid with a mask to the school because that is not what we want it to be.
Even if he tries, I don't think he will do.
Right. So that is not happening. Normally, viral infections are much more common in the first 3 to 5 years of age. So when the kids go to the play group or something and someone having a viral infection may spread it.
Yeah.
But as the age progresses, the immunity develops. So then it's not a problem. And school is a closed environment. So it's not directly onto the road which is polluted. So that way, and kids are resilient, they build up their immunity with this. And we never advise them to stop playing. Even our asthma kids, where we have put them onto inhalers, we never tell them to stop playing a sport. We encourage them to play every sport possible, but never to give up sports just because of some underlying allergic airway disorder.
I don't want to make this one as a personal counseling session on national TV.
Right.
But the challenge for at least 3 of us is when we get up in the morning, sometimes nose is blocked.
Yes.
When we come to the studio, maybe it's dust or maybe it's change in weather.
Right.
It's difficult now sometimes to operate and focus on your work with this kind of an allergy and so much of sneezing. Is there a shortcut you can suggest at least to Abha?
I'm going to buy an inhaler after this. I'm going to go look for an inhaler.
Oh God.
So if you're having those frequent problems, basically frequent change of temperatures can cause this. So if you're coming from an extremely hot environment to a cold environment, sitting in the AC, sitting under the blast of the AC, those things can happen. So there are a group of people who can get that.
Can I suggest a doctor something?
Yeah.
I sip a lot of hot water. It helps me.
That's great. So everyone finds a solution. So some people have green tea, some people find lemon water or something, clove water or something. So whatever can help you, but in the end, thing is sudden changes of temperature, we should avoid that.
Have you seen a jump in this allergic or pollution allergy related cases in last 2 years? There has been a big explosion.
Definitely. A significant jump is there. I'm like people who would normally just go for a cold or a cough to a general practitioner, especially coming to a super specialist for treating their cough. That numbers have significantly increased all across the city.
So all we can do is increase immunity.
And just one question, do air purifiers really help?
See, how much air purifiers can you use? The air purifiers...
No, but at least at work, if it's a closed environment, or at home.
See, at home also we advise for only those group of patients who have got very significant severe triggers for their asthma. Even the slightest change is exacerbating their asthma, we advise an air purifier. But apart from that, nothing. What we tell our patients to avoid at home is the use of mosquito coils and indoor pollutants like incense sticks and all other loban and dhoop that a lot of people use. That can also add to your indoor pollutants.
Well, we appreciate your time. I'm glad we had this chat.
Yes.
And thank you for dropping by.
Thank you.
Thank you
very
for
much.
educating our viewers and all of us.